Hi, everyone. Today on NextGenMD, we are diving into a brand new study published in iScience that may or may not change how we diagnose peripheral artery disease long before symptoms even show up. Research discovered that a protein called R-Ras or R-Ras, I'm going to be interested in how Dr. Lily Johnston pronounces that, when packaged inside tiny particles in the blood called extracellular vesicles, is significantly higher in people with P.A.D. It also tracks with things like age, smoking, hypertension, and disease severity as well. This really opens the door, I think, for a potential blood test that could help catch PAD just a little bit earlier, especially in patients who are often missed by traditional testing like the ABI or the ankle brachial index, those blood pressure cuffs on the legs and the arms where they measure the differential. So we're bringing in Dr. Lily Johnston to help break down what this means, if anything at all, if this research matters, and whether it does have potential. Now, keep in mind, this is truly preliminary, and just because there's a study that shows promise doesn't mean it's going to be the holy grail for PAD. So, Dr. Johnston, before we get started on this specific study, can you just offer us some precautions when patients, Dr. Google, or even Chat GPT or Grok or whatever they use, they see a study like this? What should they take into consideration?
Sure, Kim. I think, the first thing is, was this really a clinical trial or was this a fact-finding mission? Like, what was the purpose of this study? So, you had asked me before we got on camera here to ask, like, what is R-Ras? And I had to go look it up. And the point of that statement is that this is not an everyday piece of clinical PAD biology, right? This is a very upstream molecule and protein that is contributing to the development of blood vessels, but like this is way early in the process. This is not any of like the matrix metalloproteinases that I'm familiar with. There's even some of the other fairly esoteric molecules that interact in the bloodstream. This is much earlier. So, I did look it up and we can talk about what R-Ras is. However, my point of this is, when you show me this paper, I'm like, well, okay, it's sort of interesting, but I think this is like a fact-finding mission. This is really early days. This is not a clinical lab test. This was not done to understand what's really going on in patients. This was like we took samples of patients who we knew had disease and we analyzed them after the fact for this molecule, and then we compared them against patients who have some kind of vascular diagnosis but are actually really different, right? So the other thing I looked at this paper was the comparison group. There are patients who are 20 to 40 years younger and don't have all of the vascular comorbidities. So, like you said, R-Ras tracks with age and it tracks with hypertension and it tracks with all these other things. I don't know that we can walk away with this saying that we have, solution to blood tests for PAD, but we can talk about what people can do instead that I think are other really good ways to monitor. But that's how I would think about this right out of the gate.
Yep, and we're going to definitely, that's where I think we're going to end this discussion, because we want to give something, tangible for people to do and something they can walk away with. And I think that's a great idea. But first, just the study. We did have a couple of patients that came to the Global PAD Association's PAD and said, "Hey, what is this study?" And what I love, Dr. Johnson, is just the fact that they are interested. They're looking up and they're trying to find the information. And I love that they come to us and say, "What can I do with this?" And I appreciate you volunteering your time with NextGenMD and just providing a little perspective on it. So, can you explain just, before we really get started in this simple term, so like, what is R-Ras and what is the palmodulation?
Palmitilation, yeah.
Palmitoylation.
So R-Ras is a signaling molecule. It's a protein. It's called the GTPase, which basically is a specific type of protein or enzyme that signals, and it signals by virtue of how it interacts with other molecules.
Okay.
And the job of R-Ras is to help sort of build structurally sound, mature blood vessels. And so as blood vessels change, they can be leaky, or they can be squiggly, or they can be sort of not well formed, or they can have good signals that sort of like a construction foreman make sure that all of the sundry parts are put together correctly and that everything has been appropriately sanded and drywalled and painted and everything is shipshape. So R-Ras is kind of functions as this modulator that helps make sure that all of the endothelium and all the component parts are organized in the correct way and are functioning appropriately. So if R-Ras is not working, then you can imagine we have dysfunctional changes in the blood vessels or components of the blood vessels. Palmitylation is the process by which the protein R-Ras is instructed to go someplace or else. It's sort of like a Velcro molecule. You can imagine that in blood vessels, where things are and where they get stuck, like in the wall, really impacts whether those proteins can do their job and signal appropriately. So palmitylation is a step that modifies that protein after it has been synthesized, post-transcriptional modification that allows the protein to go where it needs to go or not.
So eventually, with what they discovered in the study, do you think that if something like this proves to be beneficial, that there is some sort of correlation between this biomarker and PAD that could prove helpful? Do you think that it could evolve into a blood test that helps diagnose PAD earlier than current tools like the ABI?
So let's think about, what is the clinical problem? The clinical problem is that patients have disease and we don't detect it early enough.
Yeah.
Are there other things that currently exist that might allow us to detect disease earlier? Then the answer is already yes. Certainly, we can do better imaging, right? A CT scan can show you plaque or narrowing in the arteries long before it gets to that critical place where an ABI or atrial brachial index will detect it. We don't do well enough just looking at biomarkers and risk factors, right? A patient shows up in their 60s with high blood pressure and they have pain in their legs, like that should automatically trigger anybody in the healthcare system to evaluate them for PAD. Like those are two big risk factors. We have other markers that you and I have talked about on this platform many times, like LPPLA2, which is a vascular marker of inflammation, or high sensitivity C reactive protein, or lipid particles, or LP little a, or right, uric acid,
Yeah.
or all kinds of things. We have all kinds of things that tell us that patients are at risk for this disease. So I don't think the answer is that we need another test or we need another biomarker or another reason to send a patient to the lab. We already know all kinds of things. What we need are clinicians to put the pieces together and
I was just going to
come up
say,
with the
yeah, put two
question,
and two
like, does this
together.
patient
Yep.
have PAD? Because once you ask the question, we can get to that answer pretty easily. And we can do ultrasound tests that are more sensitive than an ABI, like the CIMD that I talk about, carotid intimate media thickness. Also, you can do femoral intimate media thickness, which is actually even a little more sensitive than carotids, and all kinds of options to just look, but you have to ask the question. And I really think when we're talking about PAD as a clinical problem, that is the sticking point. It is not, do we have a test that can assess for it? I agree, ABI is not terribly sensitive. However, there are a lot of other things we can do to look for the disease once you ask the question. But the problem is somebody has to ask the question. So even if there's a blood
Yep.
test, somebody has to think about it, because it's never going to be so routine that we get it along with our complete blood count and our metabolic panel. So still, somebody's going to have to ask the question, does this patient maybe have arterial disease? And that, I think, is actually our sticking point here. It is not that we lack the tools to assess risk or the presence of PAD.
Right. I think that you hit the nail on the head on that. We don't need an additional blood marker. What we need is for awareness. It's more than 70% of people in America don't even know about PAD. And there's so many general practitioners that don't know. Well, they don't, not that they don't know about PAD, they just don't think PAD. Our sister organization, Aortic Hope, has this brilliant, campaign that they work with called Think Aorta. We need people to think PAD. And that's really important, especially with this, new wave of disease, this small vessel disease with the increase in diabetics and chronic kidney disease patients. But I'm almost answering My question from the beginning, it's just like, well, if you have diabetes, you have chronic kidney disease, there's likely, more than likely, some buildup of plaque in your arteries in your legs.
Yeah, yeah, for sure.
So I love it. So, what do you see, in terms of this study alone? Patients are going to look at it. Obviously, in a preliminary study, there are key limitations. And what should they understand about the limitations of a study like this?
Again, the limitation is that this is not a test that was designed to be deployed clinically yet, right? We're probably 5 to 10 years away from that. This is a very basic science test saying, is this one biomarker potentially relevant for the diagnosis of PAD? And the answer is maybe, right? That's what I take away from this test or this paper is, yeah, maybe. But when you look at it in the big picture, the question is it more helpful than blood pressure alone? Is it more helpful than age alone? Is it more helpful than an A1C or a fasting insulin? Is it more helpful? Does it provide more information above and beyond all of the risk factors that you and I have already discussed? Because if it doesn't add anything to that conversation, then why would we spend the money to develop it into a test? So there's not been a multivariate
Yeah.
multivariable analysis of this that talks about, does it actually add anything above and beyond the risk factors that this group of patients already were known to have, like their advanced age and high blood pressure relative to the controls.
This disease doesn't develop overnight, and although if it is due to an acute clotting situation, if it's due to if PAD, has, let's say it's a patient with an undiagnosed clotting disorder or AFib or valvular issues or an aneurysm or even cancer that might be throwing clots down the legs. Like that's a whole different story than what we're talking about. We're talking about the PAD that is stereotypical
Yeah, sure
with
is.
atherosclerosis, and it builds up over time. And you don't necessarily need this additional blood marker. You should be asking the question, does this person have PAD or do I have PAD? If you have any factors, if you have heart disease, if you have high blood pressure, if you have high cholesterol, family history of either one of those, any immune disorders, if you have diabetes, even pre-diabetes or chronic kidney disease, you should get checked. And if you're a clinician or physician, you should check the patient, period. Right? That's the way we get a
I think
handle
that's a
on
great
this.
start.
Thanks so much. Dr. Johnston, you've been such a great sport on this. I know since it's such an early study, there aren't any, real implications at this point, but when patients have questions about something, it's really good to give them some sort of answer. And I think that you've done a great job here. So thank you so much. Make sure, what's your YouTube channel, Dr. Johnston? I'm sure so many patients are going to watch this and want to follow you on your channel.
You can find me at Lily Johnston MD.
Fantastic. So youtube.com/the @ Lily Johnston MD. Also make sure you like this video, subscribe to our channel at youtube.com/the @ the way to my heart. Thanks so much, everyone.